Welcome to The Better Life with Dr. Marianne Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Marianne Pinkston.
Hello, everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Marianne Pinkston, and each week I have kind of a special show and a special topic that is always near and dear to my heart, but I think this one tops it all, and it's near and dear to my heart not only because of my illness and pain history and rheumatoid arthritis and, the 15 years that I have dealt with this horrible illness, but also because I have a 21-year-old daughter who is going through the exact same thing. And so I'm having to watch my child do this. And of course, I'm a doctor, so I'm with patients all day long. And I've seen patients for 25 years with chronic pain. So this is near and dear to my heart. I'm going to tell you really quickly, you guys can go to my website, drpbetterlife.com. And this is podcasted. Not only am I on San Antonio radio, but I'm podcasted over to iTunes, Spotify, iHeartRadio, all of the platforms. And also on YouTube, if you go to drpbetterlife.com, you will see all the links to that and more information. Now, the other reason I'm really excited this morning is because I have another pain hero here with me, Tina Peterson, who has a very long pain history and autoimmune history, much like I do, and I think worse, honestly. But Tina, welcome.
Thank you.
Glad to have you always. And she's been here before, so
right.
Yes. So always glad to have you. And we have a symposium coming up for Global Pain Association.
Right.
Give me a little bit of information on what this is and why we are doing this, because it's important, I think, for people to come see what's.
I do too.
Right?
Yes. So the Global Pain Association is a not-for-profit here in San Antonio, and we focus on the chronic pain community, but we want to provide the chronic pain community with resources, education, and support. And so this symposium is just a way for you to come out, meet some people that do some maybe alternative medicine type of approaches.
Absolutely.
To help your pain. So there's many different ways to help pain, not just prescription medications. And so you can come out and see some of these folks. Some of them have things you can try, some demonstrations and whatnot. There'll be lots of vendors out there. We're going to give you lunch, and there's going to be door prizes.
Right.
Yeah, so that's always good. But it's free to all participants, so you just get onto globalpain.org, and there, right at that front page when you log on, there's a registration form, and you just register, pick your meal, and we would be happy to see you on September 24th.
Absolutely. We got lots of great speakers talking about it. I'm going to be one of them too.
Yes.
Going to talk a little bit about my story and about how, to handle pain and all. So this is going to be wonderful, and it's limited to 150 seats. Mm-hmm. And so it's September 24th from, I think, people will check in at 9 a.m.
Registration is at 9.
Right. Starts about 10, and it'll go to the, mid-afternoon. You can come and go as you like. If you have something else to do, come anyway, even hear part of it and experience some of this. But globalpain.org, register. We've got a price behind it, but it's really not much at all, right? Or is it free?
No, it's completely free to participants.
That's amazing. Okay,
yes.
Thank you. I'm sorry I even mentioned that, but I wasn't sure. I was like $10 or something.
Free.
But completely free, guys, please.
Yes.
So come out. Now, and we'll give an address and more information here in just a few minutes, but I want Tina to focus on her story a little bit. She's got an amazing story. So tell us a little bit about, your background and what you've experienced.
Well, my background is actually biomedical research, and I've owned some medical equipment companies. I was plugging along in life, doing really good. All of a sudden, I just didn't feel well, and I didn't know what it was. I was always tired. My joints hurt really bad. I couldn't even focus because I was in so much pain. Right. And so I started this process of trying to figure out what's wrong with me. And it took many, many years until I met a wonderful physician here in San Antonio.
Who's my physician as well.
Yes.
Dr. Pendleton
Wickersham, the best. Yes. I mean, I even went to the Mayo Clinic and they couldn't figure out what was wrong with me, but he did. So that said something to me. Anyway, so, long story short, I went about going through the process of getting diagnosed. My first two diagnoses were rheumatoid arthritis and lupus. I got really sick in 13, where I had gone into the hospital for asthma.
Yes.
They put me in and started giving me antibiotics and everything, and then 4 days later I couldn't walk.
Right.
So what they assumed I had was something called Guillain-Barré, but it turned out to be an autoimmune disease called CIDP. So it affects your limbs. It's extremely painful. It's neurological, but the pain involved in that disease and that process is excruciating.
Yes.
It's those electrical nerve pains, just horrible. And then, I went through that whole process, learned to walk 3 different times because it kept hitting me again, and then I'd get paralyzed again. And it's just this whole back and forth thing. I was in the hospital, nursing home for 9 months, never came home. And then finally, by the grace of God, literally, I came home. And so that started my process of getting well. What I noticed was there's, in my communities that I would be online, there's a lot of different things happening with other people.
Right.
And so I started to research these things. And so some of these alternatives have worked for me. Yes, I do take medications because they're necessary sometimes,
they are.
right?
Yes, they are.
But then there's a lot of other things that are not medicine related that have completely removed my pain.
Right.
And one of which is CBD. And so CBD took all that pain away from all my joints, my muscles. I sleep. It's just been a godsend for me.
You are right, and I have great luck with it too. In fact, you and I are on the same thing because you have a company.
Yes, I do.
And we are going to shamelessly market that this morning, honestly, because it works. And
It does.
There's so many different
Right.
things out there. And we've talked about it. We do have a previous show. Please go listen to it because we
Right.
talk a lot about it.
Right.
But it's takerestore.com. So you can go look at that. And then I think it's 4PINK. And that helps to
Get a 10% discount.
exactly for 10%.
Right.
So I want to make sure, and thank you.
Yes.
But so takerestore.com. But on that note, your point is wonderful that not only did you take medications, I do too. I believe very much in contemporary science, although I am an integrative doctor because I think it takes the best of both worlds.
Right. I don't think it's ever one thing. I think you have to really explore and try different things because there's different combinations for everybody.
Absolutely.
And we're all different, so we
are.
never know what is going to work for us. So you have to have an open mind, and you have to just keep trying it until you find what works for you.
Absolutely.
That's my thing.
And I think it helps too if you have people who are knowledgeable in that, not only your doctor, and your doctor is very important because you got to make sure what you're taking is okay with your medicines and find the right medicines, get the right diagnoses. But, I think it's also helpful when you have other people who can help guide you through the pain process. Somebody's already been through it before, like us, and I'm doing with my daughter. I was talking to her about that this morning. She's like, "Mom, thank you so much." I'm like, "You know what? I just have to guide you through this. This is something that I know it already.
Absolutely.
I know the process. So let me teach you how to deal with your pain. We may not ever get rid of it, but we can deal with it. Now, some people do get rid of it, which is wonderful. I haven't, and so I have to deal with it from time to time on different levels, but I've learned to embrace it. And so that's what I'm going to talk about then on that Saturday, that's September 24th. That is the GPA Symposium on chronic pain. Got lots of great speakers. Register in at 9. Go to globalpain.org. Get registered. It is free. We got lots of, like she said, lots of things you can try, lots of information alternative therapies for chronic pain. So that's why we're here this morning and want to make sure you know about that. I guess backing up on kind of autoimmune disorders, and like you say, one day you just didn't feel well. And I think I see so many patients over the last 20 years, and especially since I've been sick, I notice it more now about fatigue and just achiness and unrelenting fatigue and the joint pain, muscle pain, body pain, all of these different things that, it expresses itself differently. Kind of all comes from the same source though. It's just your immune system going
Inflammation.
nuts. Inflammation. And it just chooses a body system to attack. So name it what you want. but it's all the same
Yep,
thing,
absolutely,
right? But
absolutely.
everybody is different, and so you get a different diagnosis, and you may need a different med that targets something different, but it all targets inflammation.
Correct.
And then the alternative therapies that we are, discussing, and that will be discussed at the symposium, and things that I do in clinic, things that you do, and these are all things that will help, to add to, be an adjunct to what you're doing and add to it. So it is a recipe for you,
Right.
individually.
Exactly. And that's what I think we have to figure out, is that we're not all a cookie cutter
Absolutely.
population. Everybody's different, and we have to continue. Be your own advocate. That's always been my mantra. Be an advocate for yourself. If it's not working, please tell your physician, because they will listen to you. They want to help you.
Yeah.
It's just if you don't say anything, they don't know.
Exactly.
And they just assume. And then some people are like, well, nothing's going to help me. I
You
just
feel
have to
that
live
way
like this.
sometimes.
And you
You do.
feel,
You do.
I did.
Yes.
But at the same time, once I started speaking up and just continuing to look, I found somebody that would listen. And
Yes.
that's the key.
It is.
Yeah.
And some don't. And I don't think it's they don't listen.
No,
I think
yeah,
sometimes they just don't know.
That's true. That's
There's
true. That
years
isn't
that I
fair.
didn't
Mhm.
understand it. I care, but I just didn't understand it. And I didn't, they look okay.
I know that's the biggest
Right?
thing. is we
You look okay.
fine.
Hey, look, I get up, and curl my
Right,
hair,
right.
I got my nails done and all
Right.
that. But I tell you what, inside, I feel like I just want to
I know.
bust, and
Yes.
it's awful. But, you got to keep going.
You do.
You've got to keep going, and you do. I worry sometimes about patients doing a lot of self-research. Healthcare has kind of a consumerization about it now. They market things to you on TV,
Yes.
and
Yeah.
Google has endless information.
I know.
And so I have patients who come in expecting, they find something, they expect to be diagnosed with this and get this, and I'm like, no, I need to kind of protect you from yourself a little bit, or I just want to
Right.
make sure what you're taking is actually safe or
Right,
the
exactly.
right type or kind, et cetera. So it
Exactly.
is important to, do align with your
Absolutely.
physician.
I know,
And
it
maybe you
is.
have to shop around a little bit for a doc. It's okay. You don't have to stay with one physician
Mm-hmm.
just because they were assigned to you. You can look for doctors. You
Right.
can, go to different specialists. And I don't encourage people to just, get frustrated and just stop with this doc and change to somebody else, because sometimes it's a process.
Correct.
So if you stop, you're going to go to somebody else and you're going to start all over again.
Right.
When I'm getting to where I need to be, a few things are negative and it's not that.
Yes.
And that's important, because now I can take the next step. Now your insurance will let me give you that other medication,
Right.
because
Well,
we tried this one, it
and
didn't
that's
work.
what a lot of people don't get. They don't
Right.
understand that it's the physician's hands are tied a lot.
Very much so.
And they know that, this particular medication will work, but the insurance says you have to try this and this and that, 1, 2, 3, and
Yes.
4 steps before you get to the one that actually works. And
Exactly.
it's unfortunate, but you don't have control over that. And so you do have to stay with your physician. But again, just communicate, right?
Communicate.
I think communication
and the
is
physician needs to communicate
right.
as well. Teach you
Absolutely.
these things.
Right. And, and as far as the research is concerned, I completely agree with you, because
Yeah.
there's a lot on there. And if you don't really know where to look and you don't know what you're doing, you're
Right.
not a doctor. So,
Right.
I mean,
Please
and
remember,
it's great
you're
to
not a professional,
say, hey,
so,
you know,
yes.
Dr. Pinkston, I found this. What do you think?
Absolutely.
That's
Absolutely.
okay. And that's fine,
Yes.
but don't assume you have things just based on what you read. Because, I could have all kinds of things if I would do that. So
Exactly. No kidding. I remember in medical school, everything we learned and read, I had.
Right, I know.
Right down to HIV even. I was
yeah.
like, oh my God, I've got to get tested. I mean, you feel and you
Right,
read, and so you've got to be
absolutely.
very careful. We can guide you on that, very happily
Right.
listen and guide you on that. So again, we are talking about the GPA Symposium for Chronic Pain Patients. Now, I want you guys to understand that, family members or friends or, medical professionals, there are all kinds of people we want to come to this, not
Right.
just chronic pain patients, but we really want the chronic pain community, because I feel like, and Dr. Blackwood,
Right.
feels like that, and Dr. Ellen Lynn, Dr. Wickersham, all feel like that the pain community is very underserved. It's very
Yes.
misunderstood. It is something that is, needing attention. Everything gets attention these days. Everything deserves attention these days.
Right.
But this is something I think that is wider, a larger problem
Right.
than we realize and needs to be addressed,
Correct.
because it is a
A lot of people suffer needlessly.
Suffer.
They really do.
Suffer.
And it's not necessary. So that's what Global
Absolutely.
Pain is there to support you, to listen to you, and to be a resource to help you find, a direction in which, might be able to help you with your pain.
Absolutely.
And the people that, the physicians that we have involved are passionate about pain.
Absolutely.
And so it's a great place for you to start and to get some information.
Right.
Really.
And it will be ongoing too. So globalpain.org, you can find out tons of information. We did, because of COVID, we had to do what we call GPA Live, and it was kind of a Zoom type live, I think, but a Zoom type production with Ron Aaron Eisenberg and Gene Eisenberg. And so we had that, and you can go to globalpain.org or their Facebook page, and you can find all of those. Every Saturday we recorded, I think I did probably about 8 or 9 of them. Every Saturday, right? Every Saturday we recorded a new show based on either a new piece of information or a new therapy, a new physician, whatever, acupuncture with Scott Taylor, so many different aspects. And so go back to globalpain.org, look at some of those BeLive or Zoom type productions that were done, and you can get lots of information there too. But again, we are at the GPA Symposium. This is going to be September 24th.
Yes.
Registration is from 9 to 10. It starts at 10, goes on into the mid-afternoon, 3 or 4, I think. And then, as I say, if you can't do the whole day thing, just come, even for a little while. Come hear what you want to hear. Go to Instagram and Facebook. There is lots of information there, too, about all the presenters. I'm presenting noontime. We do have a lunch that will be provided, and it is free, and it is for everybody that is involved with pain, whether it's a family member, a friend, a child, a doctor, medical professional, and the chronic pain patient. It is limited to 150 seats, and we're getting there, guys. So if you're going to do it, you need to jump on it and do it. Go to globalpain.org. And more information on me and even on Tina as well. And takerestore.com, the CBD, that is her company and her heart and soul right now, that we both take and do very well with. So takerestore.com. But all of that information, more information about me, more information about my podcast and YouTube are on drpbetterlife.com. So drpbetterlife.com. Go hit that and go back. I've got 68 shows now, I think, as of today. So go back and look. We talk about a whole lot of things. I got a lot of great guests, and so we'd love for you to hit that. Otherwise, the symposium is globalpain.org, and register and come join us, please. So we are going to take a very short break and come back on the other side and talk a little bit more about pain and how to help yourself and help your medical professional help you as well, and talk more about that. So we'll be right back.
Fatty liver is linked to 2 different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back to The Better Life with Dr. Pinkston. I am Dr. Pinkston here with Tina Peterson, the other pain hero in my life. And we are talking a little bit about chronic pain and how it affects us and other people, trying to get the word out to the community about how important chronic pain is and how it is treatable.
Yes.
And there is something you can do. You can empower yourself. And we are highlighting that there is a Global Pain Association has a pain symposium, chronic pain symposium. This will be on September 24th from 9 to late in the afternoon. Come register at 9. Lots of door prizes, lots of vendors. We've got a really big prize that'll be in that day too.
That's at the end.
We can't.
So,
yeah, that's at the end. So you got to stay
gotta
for it.
stay for the whole thing.
We got to have a bait, to stay.
You will want to stay for that.
You will want to stay. But globalpain.org is where you can go register September 24th, and it is free. And so we encourage pain patients and their families and friends and anybody who wants to be involved to come out and listen. And we've got a lot of great speakers. I want to mention those speakers here in just a second, but I know you and I wanted to touch base a little bit on the mental spiritual aspect.
Right.
A lot of people think that this is kind of a hokey,
yes.
thing, and it's kumbaya, but it's really important to get your head in the game.
Absolutely.
Right?
Absolutely,
So,
yes.
I think there are lots of resources, but how have you handled, your pain and spirituality with that?
So, personally for me, I did a lot of self-talk.
Yes.
Right?
Oh,
And
yeah. just empowering myself to that I can power through the pain and I can push myself so that I'm not laying in a bed all day or, staying home doing nothing. Because I think at that point that makes you worse. I actually had a period of time in my life when I was stuck in my bed for 2 years straight. I didn't get out at all.
Same.
And I mean, it's just, when you're stuck in that place, you're really stuck. You just feel like you can't get out.
Yes.
And I had to force myself, and a lot of it was mental. It's like, look, Tina, let's go. We can do a little bit. And I remember specifically getting up. I had one of these little gazelle things from QVC, and I'm like, I'm gonna get up there and I'm gonna move for as much as I can.
2 minutes.
That's what I did. I started off 2, 3, 4. When I got to 7 minutes, I was like, oh, I'm rocking it, But that just kind of started the process that you don't have to conquer the day, but at least get up and start.
It is, and it's just a start because it's a process.
Right.
As you start a little bit, then you add a little more, you go a little further, and then eventually you are up all day. I had the same experience where, I would go to work, but I would get up in the morning, sit in the shower for 20 minutes till it ran cold, just I gotta go.
Right.
And I'd do it, but I'd come home, fall on my face, sleep all weekend.
Right.
And, just to maintain. And then, I was also very, overweight at the time. I, did get into a weight loss, was able at that point to finally get into that, and then started working out. People are like, my left ankle's fused, my thumbs need transplants.
Right.
People are like, I run on a treadmill. How do you do that? Well, I didn't do it overnight,
No, it takes time.
It takes time.
And that's what I tell people a lot of times too, is even if you just move for 2-3 minutes several times a day, if you add that up over the day, that's a lot of movement. And the more you move, the better you'll feel. And it sounds counterproductive, right?
Does.
It's like, it hurts. But if you really can just push through for just a short time, it makes it better. It really does.
And it was Dr. Wickersham who told me at one point, if you exercise, he said, like you, it's counterintuitive. But, at first it will be really tough in the first couple of minutes. But what you're doing is you're pushing inflammation out. And once it's out, then you loosen up and you feel better. And over time and it's something he told me that I carry on my phone all the time. He says, everything you have done to this point, Marianne, matters.
Right.
And it does, because now I'm another year ahead, another year further. I'm not going to succumb to this disease as soon as I thought I was going to, because everything I've done to this point matters.
Well, I think, and that's another thing. You have to say, I am not going to succumb to this disease. I am not this disease. It is not me. I didn't let it in.
Right.
Be gone. Just get out of me, the kind of thing. And you have to have that mindset, even though your body hurts and everything else. If you can just convince yourself that, it doesn't own you, that really helps. And it sounds so silly. I'm like, oh, right. When somebody first talked to me about self-talk, I was like, oh, no, I don't. This is too weird for me. But once I started doing it, it was like, oh, well, there is something
really
to
does
this.
work.
And there is actually some studies based on that, right?
Yes, absolutely.
So, I mean, it proves that if you can mentally, push yourself through, that you can. And you
can do anything you want to.
Absolutely.
In all actuality. So this has been such a great talk. I have enjoyed having you on. We we gab, we get going, and we can't stop because we've got so much in common. And so again, I want to mention that the Global Pain Association has the Global Pain Symposium on September 24th. Registration. Let's give an address. I know you've got an address here.
So it's at the New Star Energy Building at 19903 Frontage Road, IH-10 West. Yes.
And again, registration starts at 9. The actual symposium starts at 10, but we encourage you to come early because there will be a line for registration and you don't want to have to stand in that too long. So the earlier you come, the
better.
But
and
also
you get
vendors.
to see,
yeah, and there's a lot of vendors to see.
Right.
You may want to walk around and see some of the vendors before it starts.
Right.
So yeah, there's
and
lots
get some
to
great
do.
information
There's
of
gonna be
people who are
coffee
there.
and food and water,
exactly.
all kinds of goodies. I think
Right.
they may even have dessert. I don't know.
Hopefully.
We'll see for those people that
Hopefully.
like that. Yeah.
So globalpain.org. Get registered, please. It's limited to 150. That's the biggest room we could get at the moment. And it is going, so please get on there and register. It is free. Please come. Got lots of great speakers, door prizes, got a prize at the end. And again, more information on me and on Tina will be on drpbetterlife.com. And we hope to see you there and to join our
Come find us.
Exactly. Come join us because we really can help, and we've got a lot of things back there that will help. So that's what we're here for, globalpain.org, guys. Thank you very much. Have a great week, and see you next time.